Hey, how's it going? Hey, Matthew, nice to meet you. I'll be doing your physical assessment today. If you want to go ahead and just follow me in here. If you want to go ahead and just grab a seat. Go ahead and start a 5-minute timer just so we can get a good little rest here. We're going to do some paperwork. This first form is going to be the PAR-Q. This is our physical activity readiness questionnaire. It's just going to ask you a couple of questions about you when you exercise. If you want to just read through these questions here, answer yes or no, and if I can have you sign and date at the bottom. That you got all those answered. If you want to go ahead and just print your name here, sign here, and date for me. Alrighty, thank you, sir. Take that. This next form is going to be our informed consent. We're just going to read over this together. This is basically going to tell you what all we're going to be going through here, and I'll have you sign at the end, giving your consent. It says, in order to assess cardiovascular function, body composition, and other physical fitness components, the undersigned hereby voluntarily consents to engage in one or more of the following tests: cardiovascular exercise test, body composition test, muscle fitness test, flexibility test, and balance test. Students in this class will evaluate pre-screening documents to determine risk factors for heart disease, as well as contradictions to certain cardiovascular strength training exercise. With the supervision of the instructor, students will conduct a battery of assessments for the client. Students will also interpret the results from the fitness assessments. During the assessment portion and or the exercise portion, physiological changes will occur as normal acute response. However, in certain cases, these changes can include abnormal blood pressure responses, fainting, irregularities in heartbeat, and heart attack. Every effort is made to minimize these occurrences. Emergency equipment and trained personnel are available to handle these situations should they occur. There is a risk of muscle pulls and or strains, as well as spraining a ligament during the exercise session. These risks will be minimized by performing a warm-up exercise prior to the workout. Teaching proper technique and applying the progressive overload principle. If muscle soreness occurs, appropriate stretching exercise to relieve this soreness will be demonstrated. The fitness testing also allows us to assess your physical working capacity and to appraise your physical fitness status. The results are used to prescribe a safe, sound exercise program for you. Benefits for the students are immeasurable. They will be able to take the knowledge gained in the prerequisite courses plus the knowledge gained during the course to apply to knowledge to you. Your feedback is visual to their growth. Questions about the procedures used in the fitness testing period are encouraged, as well as the prescription phase of the project. If you have any questions or need additional information, please do not hesitate to ask your trainer, which would be me, or direct comment and questions to the instructor of the record. I understand that photos and/or videos may be taken during the session strictly for educational purposes and will only be viewed by the student assigned to me or the instructor of record. I understand that I may also request these photos or videotapes at the end of the course. If my video is chosen to be used for educational purposes in class, my permission will be obtained prior to the class session. Your permission to participate in these fitness tests is strictly voluntary. If you are free to stop the assessment and or prescription at any time if you do so desire. For myself, all of my heirs, personal representatives, successors, and assigns, or any other persons claiming by or through me, I do hereby waive, release, and relinquish any and all claims, demands, causes of action, liabilities, costs, and or expenses, including but not limited to, attorneys, fees, all reporting be referred to collectively as claims against UCA, the Exercise and Sports Science Department, and instructors record and or students enrolled in this class, which are associated with or arise of or in any manner to relate to my participation in this class course during the spring 2020 semester. And then this is just kind of saying that this will be copied. It also says that you certify that you're at least 18 years of age. It says that you have read this document, and I have read this to you, and basically if I'll just have you sign here at the bottom of the consent saying that you understand and that you were given all of the appropriate information. And while you sign that, I'll go ahead and get started telling you what we're going to be doing. This first assessment is going to be your resting heart rate. We do have to test this after 5 minutes of rest, which, as you can see here, we're a little over 6 minutes. So we're good there. There's 3 places that we test for heart rate. It is going to be your radial, brachial, and your carotid artery. What we use to test those is a method called palpation. Palpation is just where we take our fingers and we place it on the artery and we feel for a beat. The importance of us testing this is to get a good glance of your resting heart rate to show your cardiovascular fitness. Cardiovascular fitness changes during exercise, so we got to get kind of like a base ground of where we're at before we actually start. So it's going to be a 60-minute count. If I could have you place your right arm out like this, flat on the table. I'll go ahead and start the timer. There'll be a little bit of silence. We can't speak during this just so I can get a good count, so I'll go ahead and start that. All right, so your resting heart rate at 60 seconds is going to be 84 beats per minute.